I'm going to talk about a partnership that's just really in its infancy stages. We started last year with a hospital called Lalgarh Leprosy Services Centre, which is in the southern part of Nepal. I used to have maps and all that, but I was told 3 slides. So, and it's a place that I used to work. The connection is that I actually went there to work back in 1993 and stayed there for 2 years, and have kept connections with the people there. And I suppose it must be a reasonably sustainable model, because most of the senior staff there are people that were there 20 years ago when I was there, so I still have that connection with them. I was looking at what the requirements were for this presentation. So I suppose what we're discovering is that identifying the needs of the partnership is actually, it's important, but it's also important to approach it with an open mind. So maybe from where I started, thinking what our needs were and what their needs were, and them coming to me with what their needs were and what they thought our needs were, I realised that, there may be a bit of a mismatch there. So it's a matter of, I suppose, of finding the common ground that we can build a partnership on. So whereas I'm just going to talk mainly about this little slide, because it kind of speaks to a lot of what we have here. So this is actually when we did go and visit last year, and the woman there on the right is my boss, Dr. May Mannix, and the other 2 men are men that I worked with 20 years ago when we were all young. And there's quite a lot going on in that picture in terms of our partnership, because you can see this is on what would have been a week school day, and children should have been in school. We're visiting a very, very poor village. These people live in extreme poverty. These kids eat every second day, mainly. Their mothers forage for food one day and they eat the second day, and you can see from their hair and everything that they're actually quite malnourished. But they're not, they're not on starvation's door either. But they don't go to school. They're extremely poor. They're what called Dalit people, so they're outcasts. And the interesting thing about this slide is that this gentleman here. Do I have a little red pointer? No. Oh no. That bit. Oh yes, this gentleman here. He would have started off life as one of these kids. He would have been from a very poor. He actually would have been even worse off than one of these kids. He grew up in what would have been a leprosy colony, and he's one of his parents had leprosy, and so the whole family had to go and live in this colony. And he would have grown up with no access to education, dependent on charity for food. And not allowed to leave, and all this kind of thing. And from there, I suppose, his life has moved on. He got access to education. When I worked with him, he was a healthcare assistant. He's now actually a qualified doctor. And his story tells very clearly the overwhelming kind of aim of Nepal Leprosy Trust and Lalgarh Leprosy Services Centre, which is to bring people out of poverty into good health, into education, and into just being empowered for life. And the other important thing to note, the thing is that they're very well able to do that in Lalgarh. They have the skills, they know how you go about it, they know about education and vaccinations and maternal mortality and birth, midwives and training all these people, birth attendants, all that. They have all that capacity. And a lot of what they need really from that point of view is just, I suppose, funding, and they have had some Irish Aid funding through community program that they do, and they get funding from various other places, and they do this. But what they really identify as their need, from our point of view, is also quite evident in this picture, in that you see our 2 workers here are well on their way to, being candidates for chronic disease. And this is one of the main problems that they identify. This is, again, like we've said everywhere else, or other people have said, this is what happens. You give people access to education and improved health, and they live longer, and they develop chronic diseases. So they are now dealing with COPD, diabetes, heart disease, and they do not have a lot of expertise. And so what they really see as, the benefit of the partnership with us is access to, I suppose, education and that sort of thing. We have some problems. Because they're 6 hours away, there are only actually 8 hours in the week where their working day crosses over with our working day. So that makes actually communications quite difficult. It's obviously not impossible. They have Wi-Fi, they have the internet, but during the monsoon, which is about 4 months of the year, and the thunder and lightning that accompanies it, generally they're copper-based. I don't know these technical terms, but they have this internet, connected system network. It generally melts because it's hit by lightning, and it has to be replaced or repaired or whatever, so they kind of get cut off. So one of the things that we have been working on is trying to improve communications, because I think a lot of what we will be doing with them will be around the whole education space, and both for them and for us, because we're very interested in being able to send some of our trainees out there. But again, we can't get funding for our trainees until they can be properly supervised. And so what we're hoping to do is to improve that whole communication space. Now, we have had some progress. We've got what's the word? We've been awarded a grant from Cisco, which is a big IT company, and they've donated $20,000 worth of teleconference facility, which is the first step, I suppose, really towards setting up a situation where we can have joint education sessions and joint meetings and that sort of thing. We have done Skype, but when you have a group of people in one room and a group of people in the other room, Skype's not the version of it that we have doesn't work that well, and we haven't found it very satisfactory. The other thing that we need, obviously, is to make sure that all their network is lightning proofed. So that's another thing that we're helping them with. And hopefully we'll be moving on those kind of things shortly. So I suppose, yes, we've made some progress. We have had some difficulties. Just finding time, I find to be very difficult. As you say, when you want to make contact, you can't make contact, and then when you have time, when you can make contact, you haven't time to make contact, and this kind of thing. So it's just a constant battle to try and find time. I think that's it, really. I'm not terribly well prepared, I'm afraid, but if anybody has any questions, it would be better afterwards.